Organisma, New York. Your exotic skin, hair, and beauty source, and your one-stop shop for all your natural and organic skin and hair care, featuring authentic organic Moroccan oil and prickly pear seed oil and much more. Bringing you only the best, straight from the source and proudly produced in the USA. So what are you waiting for? Shop today at www.organisima.com. Organisma, New York. Your beauty is our duty. Organisma, New York.
All right. Welcome back to the iHealth channel, iHealth Radio with Hurricane H. New day, new show, new topic, new guest. I have an MD and I have a doctor with me, and we're gonna kind of twist things around. And I like to do that every now and then and bring in some new flavors, new concepts. And we talk about medicine and healthcare, and there are a lot of topics we can cover. We can cover days and days and hours. But there's an angle about it that we sometimes do not, link to the healthcare and to the provider side and just health in general. And today we're going to have specialists with us who will actually guide us through a whole new view of things. And he is an author that wrote a book about it recently, and we're going to talk about that. And so he is a doctor, and he'll tell us more about his practice, and he does just more than just MD stuff. He's actually beyond that. And so we have with us Dr. Vimal George, or Dr. George. There's different, he's known differently in the space of medicine and his world as an author as well. So first things first, Doctor, welcome to the show. Welcome to iHealth channel and iHealth Radio. I love your stuff and your angle. And I think we're going to really throw a little spin on our people here. So our audience will be like, what the hell? This is a health topic. It is. But we're going to talk about, the primary piece of, an MD doctor. And we can talk about that. And then we can really dive into how it all correlates to everything else in finances and things. And I'm using the word finances here. I'm like, wait a minute, what does that mean? We'll talk about it. I'll leave that to you, right? So before I get, any further, please tell us a little bit about yourself, your background, and your just story.
Sure. Thank you so much, first of all, Hurricane H, for having me on the show. It's an honor to be here. So just to tell you a little bit, I'm a family doc. I practice here in Austin, Texas, in a fairly traditional medical practice. It's a multi-specialty group. I've been practicing medicine for over 15 years now, since after my residency, and kind of worked my way up to the position of chief of family medicine, and then eventually as chief of quality for our multi-specialty clinic, which has about 150 providers. And I kind of came to recognize in my position what a lot of folks in the healthcare field are well aware of, which is that chronic disease is increasing year by year. So if we think about rates of diabetes or rates of obesity or rates of Alzheimer's, colon cancer, major depressive disorders, all these things are increasing year over year, including healthcare costs. And so, basically I'm kind of looking at it from that position and seeing that, hey, we're not really making an impact, and we have to change direction. We have to kind of work a little bit differently than we are now if we're going to make an impact on health. So
that's great. Well, so let's break that down. I mean, because that's a lot of stuff. And the first thing I want to just talk about is just family practice in general. And when you're a primary doctor, there's different levels. You're in internal medicine, you can be a pediatric. I mean, if you specialize in kids, but certainly family practice is a little bit of everybody. I think if they're, it's kids to adults, right? I mean, that's the age group. Is there a limitation for you in terms of practice?
Family physicians vary from one provider to another. I would say most of us do, from pediatrics to geriatrics. Mm-hmm. Some of us do more from, younger teens to pre-geriatrics. I kind of run the full gamut from, really kind of age on 5 on up to 108. One of my patients was 108 years old. So that was
Wow,
my
God
record. So
bless.
yeah. So,
Well,
we see a little bit of everything.
and thank you. And the reason I'm asking, because I mean, just to clarify for people that, I mean, I'm in the insurance world and the payer side, so we know about all the specialties and the different groups. But some people may be clear about it, some may not be as clear, and so I wanted just to clarify that. And which means in your case, you cover almost everybody under the sun, and that gives you a lot of different angles and more access in a way, because a lot of folks, sometimes they prefer, like I prefer a family practitioner, for example, because the whole family goes there. Records in one place, and my kids are there, my wife is there, everybody is there, so my mom is
Right.
there, so it makes more sense for us to be that way, and so we can make appointments together. It makes sense that way. Now,
Yes.
you mentioned that you are in a practice that has many doctors, so I guess you have subspecialties, different things, so it's a full clinic, full operation.
Sure. Right. Right.
And that also makes it more interesting, because now you're talking about almost every service that's under the sun.
Yes. Right.
And you mentioned chronic diseases, which basically a lot of these specialties, subspecialties will be, treating or at least dealing with. So you have a variety of patients from every age group and probably every condition that can be, available out there.
Absolutely. That's exactly right.
So again, I just wanted to clarify that. And so thank you for that. Now, let's talk about, you mentioned healthcare costs.
Yes.
Now that's a topic we probably can spend hours on, and we may never run out of it. I mean, first of all, the healthcare system in the US as a whole is a little different from a lot of places around the world. There's always a question like, it's expensive. We always say that. You hear that all over the place.
Yes.
Employers are giving less and less, and there's so many challenges that are out there. And healthcare is a lot of things. I mean, there's the folks that have plenty of money and they can afford any policy. There are the folks that are middle class and they rely on their businesses or jobs to provide care for them and their family. Then you have people that rely on government programs, whether it's Medicaid, Medicare, or any of those other programs. And that the healthcare cost here varies across all those.
It does.
And what you get and what kind of insurance you have and so on and so forth. Insurance world is another one we can also talk about a few hours here. So what is your experience? I mean, ultimately, you've done this 15 years, and not just as a particular practitioner yourself, but also as a clinic, as a facility. That's a lot of stuff. I mean, admin costs and all the stuff that you have to handle. It's not easy.
Sure.
So let's guide us through the whole process, and then we can dive into your, I guess, financial piece and the whole book, and how the book was designed. And we'll talk about the book more.
Sure. I think what you're getting to is that, there's a lot of different things, a lot of different variables that add to the cost of medical care. And it is a very expensive healthcare system in comparison to other developed countries. It's actually the most expensive, and in fact, by a factor of almost 2 to 1. So twice as expensive as most other European countries, for example, and countries of the Organization for Economic Cooperation and Development. So if we're looking at, statistically, we spend twice as much, and yet our outcomes are, mediocre to perhaps a little bit less than average among the developed countries. If you look at rates of longevity, for example, we actually live a little bit shorter life expectancy. We have a shorter life expectancy than many of these other countries. Our rates of chronic disease are higher in comparison to several other countries. Our infant mortality rates are higher. Maternal mortality rates are a little bit higher. So a lot of different things that maybe we're not quite living up to our potential. In other words, we're spending so much of our resources, but really getting very little bang for the buck. What does that come down to? There's several different factors that, people have traditionally pointed to, and there's a lot there we can, spend days on, but, basically the lack of coordination of care. There's the high administrative costs. There are higher costs in general. In other words, prices are just set very high. There's, the fact of higher readmissions. There's the prevalence of chronic disease. There's the lack of coordination between the hospital side and the outpatient side. So a number of different variables that, we do, we're well aware of. What I tried to add to the discussion is that there really is another, central factor, that's sort of an elephant in the room that really is kind of unrecognized and unaddressed, that's driving a lot of this.
So we'll get onto that one in a minute, but I wanted to just go back to the element that you mentioned, which I think it's really a big deal. The fact that we're twice as costly as European countries, or, like, to your point, modern, advanced world countries, right?
Sure.
And yet we have lesser, outcome, as you said, longevity, mortality, but that can be for a lot of audiences right now. And by the way, the show is broadcasting, people listen all over the world. So people will be like, wow, I mean, that's statistically, that sounds really crazy, or almost unbelievable. Even for Americans, we're like, really? We thought we had the best healthcare here. I mean, we're the most advanced nation when it comes to, medicine and stuff, potentially in terms of, studies, research, breakthroughs and things like that. But to your point, cost-wise and then outcome-wise, I think that's really when you compare those two elements together. Not so much in the quality of care, but even that, I think maybe some places in the world can have just super quality. I mean, Europe is, you said it. I mean, Europe is a big example that we can use. I mean, Canada next door. Some people also will argue, well, if we're costing twice, somebody's paying for these other countries too, right? And yes, of course, there's always somebody's paying for services. It's not free, nowhere.
Sure.
I mean, whether it's subsidized through the government or private entities or businesses, somebody's paying for it, or private pay. You just go and pay. One way or the other, someone's going to pay for it. But you mentioned some costs that are attached to the care, and there's contributors. I mean, let's call it what it is. I mean, med school is not cheap, and the minute you get out of there, I mean, you have a lot of costs already attached. You open a facility, it's got stuff, medicine cost, equipment costs, everything. It's not as just, hey, let's just have this, make it work. There's a real, I guess, technological aspect of this, but also it comes at a price. And industry wise, this is like, it's been going on for years. This is not new. I think it's escalated over years, and it's just gotten worse and worse. And today, probably more than ever, it's sometimes very difficult to access, and especially depends on where you are. That's, I think, the other piece. Some larger, I guess, cities will have a different impact than maybe smaller areas. Suburbans versus metropolitan areas will have different, I guess, systems and costs attached to them. So you are in a metropolitan area, and it's a decent proportion size in terms of population. So how do you handle it in your world in terms of meeting these expectations in terms of cost and managing it and still providing care, adequate care?
Yeah, that's a tough question. I'd say that we're not adequately meeting the need, right? And so what's happening is that, in fact, we are kind of not able to control the cost of healthcare. And so as a result, what we're seeing is that actually driven largely by chronic disease. I mean, 75% of the cost of healthcare are chronic disease related, and largely driven by the rise of chronic disease, we're unable to contain the cost of healthcare. Not to mention the fact that we're not able to contain the rise of chronic disease. So in other words, if these things are increasing over time, obesity rates, for example, some of your listeners might be shocked to learn that between patients, adult patients in the United States who are either overweight or obese together, that's 73% of the population.
Oh my God.
73% of the population among U.S. adults are either overweight or obese. That's straight from the CDC statistics. And so basically, not only is that shocking, but if you look at the rates of which it is projected to rise to, it continues to rise year after year. And this was not the case 50 years ago or 100 years ago, or even 20 years ago for that matter, right? I mean, there's things that are changing that are causing the rise of the chronic diseases that we're seeing today. And so, to your question, what is it, how is it that we're managing? Well, we're really not. We're kind of putting bandages on the problem. We're able to keep our patients from having some complications of diabetes, for example, but we're largely not preventing them from having diabetes in the first place, or colon cancer in the first place, or major depressive disorder, Alzheimer's, or whichever chronic disease that we're talking about. For the most part, we're really not doing a good job of preventing it. We're only kind of treating it to prevent complications after the fact.
So, Doctor, I don't want to sound controversial, but I do want to ask this from your opinion. And again, we don't have. This is not a political scene, so we're keeping the politics out of it. But I think there's a challenge because, and I agree with you. I asked the question on purpose because I know we're not equipped adequately nowhere. I mean, especially in the bigger cities, it's crazy. But you said it yourself. I mean, there are some key elements that have been trends. Diabetes is on the rise, obesity is on the rise, and a lot of people will probably say, well, we can't prevent it. We can't potentially prevent it if we do certain things. And now people get a little crazy. Well, some industries are factored in this. I mean, they have a say in this. For example, nutrition, food industry. I mean, there's a lot of sugar business.
Sure.
And all these things can be contributors. You have pollution, talking about cancer and all other stuff. There's so many things that can be done. I mean, the food that we eat, there's the whole debate about organic versus not organic. So these, some of the folks probably like, well, if we did this, and there's a big, I guess, movement. There's the provider side, there is the industry side, there's the activist side, and everybody's pushing from their end. But at the end of the day, we all want the same. I hope that we all want the same, is that we want people healthier. And there are people that would argue about that. They say, well, doctors don't really care. They get their business to keep you going so they can keep it. And I'm being real about it, but
no, absolutely. Yeah.
Doctors, well, if everybody's cured, well, what we need doctors for, right? That's, so some people may say that, or some people say, well, doctors are not advocating enough for all these things, which is not necessarily true. Doctors are advocating. They are doing their job. Yeah. And unfortunately, you are in a very difficult place because you are the caregivers, you are the providers that help people, and you give preventative stuff and measure. And but the problem, people come to you, it's too late. That's one. Unless they start, like in your case as a family practitioner, you can start with a kid and you follow them through their age groups, and as they age up, about everything they have. There's a better chance to almost prevent things as you guide them through that. Sure. A lot of people switch doctors and they don't even they don't even see a doctor until they're sick. That's the other transition, and we have that in metropolitan areas. You'll see a lot more people going to emergency rooms than going to primary care doctor. Sure. I got a headache. Let me just walk into the ER, see what's going on, get a couple of pills. That's the problem. There's no real emphasis and focus on preventative measures or focusing on doing your physicals and your annual checkups and having an actual direct primary care to take care of your history, your family, your DNA, everything. I think that's part of the problem. So educating the people in general, the behavior part, but then the other aspect is how to interact with what's available in society. So food wise, we consume alcohol. That can cause problems, right? Sure. Drug, that's a problem. Like I said, a lot of factors. Some people like to take sometimes medicine and they say that it has other effects and it can be problematic. So there's so many potential blames that we can put out there.
Of course, yes.
So now you've heard those and you have to deal with that. And most people will probably say, well, you're a doctor, you're going to do the best for the doctors community, right? But really what I want to convey here is that I believe in the message and the mission of the doctors. And I think doctors, we need you. We want you to be out there because you do save lives and help, people. But you're right. At a degree, if I come damaged, what can you do possibly for me? You just have to help me manage what I have in front of you. it's too late. But I think your program, your book, doing these types of shows, bringing people into the service and teaching them how to be potentially better before they get before it's too late.
Yeah.
So what is your secret formula here?
So this is an interesting one. It's a little bit of a discussion to kind of get to it. Okay, but
we're here for it. Go for it.
So as I mentioned, we're seeing the rise of chronic disease, the rise of obesity, the rise of healthcare expenses, to the point that we're now spending $3.8 trillion per year on our healthcare expenses, and that's by far more than any other country, and it's 20% of our GDP. That means we're not able to spend on education and other things that we would rather spend on, right? So it's lost opportunities. So basically, what I try to point out in the book is that a lot of what's happening, it's driven, this rise of chronic disease is driven by factors that you would have a hard time realizing. So, and so in a word, it has something to do with our system of capitalism, and the combination of that on the one side with the fact that by human nature, we tend to do things that are not necessarily in our own best interest. So we tend to conflate pleasure for happiness, and as a result, we tend to make poor purchases. And so the end result of combining this system of capitalism, which is a very good system potentially, but with that in combination with our tendency to mistake pleasure with happiness, the result is that we tend to mindlessly consume. And so mindless consumption, as I call it, leads to the rise of chronic disease. And you of course will now come to think of how is that even related, right? And so let me suggest that there's really kind of four major ways that that's happening. But to really understand that, you have to take a step back and understand that if it weren't for our mindless consumption habits, that we would actually get to the point of becoming financially independent of our employers. Okay, let me just kind of set that aside for now, and come back to that part of the discussion. Okay, because there's a lot to explore there.
That's an interesting topic, and I know we want to hear about that. Go ahead.
Yes. But I'm going to first focus on how consumerism is actually leading to chronic disease. And so, in the first place, we are, as a result of mindless consumption, now tied to our employers. And modern day employment is a health hazard in a way that a lot of folks would have a hard time realizing. And what do I mean by that? Well, we are basically sitting in a chair in front of our computers from 8 to 5 for the majority of our workday for years on end. And in addition to that, you're also sitting through traffic to and from work. And so obviously very sedentary, right? And we all know that a healthy diet, exercise, and good sleep are fundamental pillars of healthy living. So there you go. Exercise is just out the window right off the bat. Second, this lifestyle also, most folks are either grabbing breakfast on the go or they're skipping breakfast. Oftentimes lunch is in a hurry, and they oftentimes don't have time to prepare a nourishing meal for their kids at dinner time. And so as a result, we've kind of lost out on the opportunity for a healthy diet and exercise, right? Not to mention the fact that a lot of us are stressed or overworked and are probably compromising sleep. And so insomnia is adding to that. And that's the first way that our habits of mindless consumption are adversely affecting our health and leading to the rise of chronic disease. Second, if you look at the healthiest living people around the world, they actually, if you ask them, what is it that they're doing? What's the secret to healthy living? What is it that you guys are doing that leads to such long, healthy lives? And the answer, you'd be surprised, is that they don't seem to know. Okay? They don't seem to know. And the reason is, it's because it's actually engineered into their everyday lives. So for example, just to give you an example, we come out and we get out of our house, we have a garage, we get into the car and come out to our next destination, right? For work, for example. But a lot of those folks, they may not necessarily have paved roads next to their house. And the result is that as a result, they have to use their legs to get to wherever they're trying to get to. They have to use their legs, whereas we have engineered out the meaningful use of our legs, the meaningful use of physical activity in a way that's adversely affecting us, in a way that we're sort of shooting ourselves in the foot. so that's kind of the second major way. Third, our consumption habits have also led us to adversely affect the environment. Climate change is only the most obvious of those ways, but even if you look at species extinction, by some estimates, the rate of species extinction is hundreds of times, maybe even 1,000 times higher than it was historically in the present age. And that's leading to opportunistic infections, including the rise of infectious diseases, possibly including COVID. I don't make the case for COVID being part of that in the book because I want to not get ahead of the science, but that possibly is related. And increasingly our environments are increasingly artificial. And we know that our bodies are best meant to live in natural environments. We flourish much better when we're in more natural environments. So that's kind of the third way. And then fourth, and this was a little bit more of a challenge to understand this, but fourth major way that consumerism is adversely affecting our health. If you think about the opportunity cost, so if you were financially independent, the reason people work who are financially independent as opposed to a person who is dependent on their employer is actually different, okay? A person who's financially independent, they work because they love the product or service that they are trying to produce. And money is instead a side effect. Whereas a person who's financially dependent on their employer, they work for money, and the product or service that they are producing is instead the side effect. And this leads to huge implications in multiple ways, which I kind of talk about in the book. But just to give you an idea of how that can adversely affect us, think back to, I think back to a quote from Upton Sinclair, who is a novelist from the 1920s. And he had an interesting quote. He said that it is difficult to get a man to understand something when his salary depends on him not understanding it. so in other words,
that's true. It's deep. It's deep.
It is. So basically what he's saying is, in a sense, we're much more vulnerable to compromising our own integrity when we have to work for money, because that's what we end up having to, rely on because of, unfortunately, of overconsumption. Again, most folks, if they recognize that as the issue, if they recognize that they really are over-consuming, they do have the potential to become financially independent. So you'd be consuming a lot less, which means you have a lot more available to be able to invest. And when you make that investment, you can get to the point of being independent of any employer for your income. In other words, you quit working, you would never run out of money. You'd still be able to sustain your day-to-day living. So no, it's a long-winded explanation, but
no, that's actually perfect. I love the transition, and I mean it almost is as clear as it sounds. You're right. All these are true factors that we've been living, and they are happening, and we are aware of them. And to your point, I mean, as the philosophy that you just quoted there, is reality, because at the end of the day, you're right. If I have to work for a living, and let's say my production is something that is whatever, I will, whether I like it or not, I'm still going to do the job. And so, and to your point, I'm not, investing in anything, so I will continue doing this. Now the thing with this, right? So people are listening to this show right now, and they'll be like, well, if everybody does get to that financial freedom, well, who's going to work for these companies?
Yeah. Yeah.
But I want to just add one more thing.
Yeah.
So I've been reading a lot about this, and it's amazing because there are a lot of people, there are advocates out there, and they can clearly say that the system has almost been rigged that way, because from school, you are trained to be an employee, not an entrepreneur.
Sure.
Nothing that you're taught to work 40 hours, not to be able to do your own thing. It's
Yeah.
almost like by design, it's been that way.
Yeah.
And
Yeah.
90% of us will probably just, again, that rat race. We wake up, we do the same thing.
Sure.
You ask kids, what are you going to do? I'm going to be, and don't call me a doctor, a lawyer, a teacher, the usual, right? A cop, this.
Right.
Now, so there's but I want to make sure that I clarify something. When I say doctor, you are a doctor, but also you're an entrepreneur. That's a different story. But that's the thing. A lot of doctors are business people. And, so beyond the practice of medicine, they tend, and I know a lot of them that actually have enterprises, I mean, different, systems of, clinical and medical and things like that, and even other types of ventures. So they turn it to an opportunity of business and financial stability. Dentists do the same, and so on and so forth. So, but you're right. The average person will tend to finish school, to get a degree, to get a job, to get a pay, and work that paycheck to paycheck, save some money, maybe do vacation, then start thinking about college degree for the kids, and then save for those, and that's just life. And before you know it, like I was reading this particular post, and it really gets in my mind every time I see a similar one, whereby you work all your life to retire at 65. How much more time you have to enjoy?
Yeah.
I mean,
and oftentimes with a lot of health problems as well, right?
Exactly.
I mean, you retire with healthcare costs and adverse health effects. So,
and not a lot of money to retire on to start with, which means now, again, your choices for food are going to be limited. And that's going to affect your health probably worse, so
absolutely,
it's almost like a vicious cycle. It just keeps
coming
back around, and it's hard. But you're right. Today, there's a movement, and I'm seeing a lot more, especially in the crypto world and investing and the stock and a few other things. There's NFTs now the metaverse. We had all these discussions going on right now, hot discussions, but still a lot of people are not coming to it. They're still not. They're still not seeing any value. Bitcoin was just a joke. Then now you want to own a few of those Bitcoins, right? But so it is a reality, and you're right. Putting all this into perspective for health, we usually don't connect those two dots. They're like totally opposites. But you just laid the foundation to believe that your better health is also in your better finances.
That's kind of shocking to hear in a lot of ways, right? When you think about it, and I'm kind of going back to some of the points that you made, which is that we kind of grow up in a system that is training us to do this, right? In a sense, you might recognize the title of my book is Health in Flames. The subtitle is A Doctor's Prescription for Living Beyond Diet and Exercise. Well, in a sense, the prescription that we've been given is a politician's prescription, right? So our leaders, our politicians, they've kind of given us a prescription for living that calls for increasingly spending more and more of our income, and the pursuit of on a nationwide level. So on an individual level, it's just increasing consumption, increasing individual consumption, spending more and more money. On a nationwide level, that translates to growing GDP, right? And so the prescription, whether you're on the right or on the left of the spectrum, in the political spectrum, the focus is on increasing GDP growth. And the idea is that by increasing GDP growth, we'll have more and more of the things that we want. But when we look at what we are really after, which is good health and well-being and ultimately happiness, what we're seeing instead is as GDP is increasing, and particularly in the United States, what we're seeing is actually happiness levels are actually dropping in these last few decades, especially. Now, I don't want to minimize the point, because to a certain extent, the pursuit of greater productivity and greater growth in GDP has actually translated to improved health outcomes. So I don't want to minimize that. But beyond a certain point, after we've met a lot of our basic needs, having enough food and security and health and housing, shelter, all those, once we've met our basic needs, some of the additional growth has actually adversely affected our health. So that overconsumption now is actually, this pursuit of GDP growth is actually driving overconsumption, which is adversely affecting our health.
Well, so let's talk about that. I mean, it's amazing, but we live in also a society that is like 20 years ago, 30 years ago, before the internet.
Yes.
You saw things around the world through movies. That was kind of the first, maybe books, maybe the news for those people that had satellite back in the days, you may have that opportunity.
Yeah.
With the internet now, everything is out of the palm of your hands, and you have so many social, media opportunities, and we have now influencers, which beyond just the typical actors and the people that we looked up to, and or maybe commercials, now we are getting it from individuals who are actually promoting products left and right. And what you see, we become also a society of keeping up with the Joneses.
Yes.
Yes. You have a bag. I mean, especially in the ladies' world. I mean, you have a Birkin. I want to have a Birkin. I mean,
of course.
now, we're not talking about cheap stuff here. We're talking about some people's livelihood that can equate to a bag.
And it's not just I want to have it. I got to have it, right? So.
Exactly. That's exactly right. So, and again, I went to the Birkin, but we can start with Coach, and we can start with Louis Vuitton. Yeah. We can go with smaller stuff. But at the end of the day, people are almost like trendy to the point where they'll sacrifice everything. They wind up in debt. And ultimately they're stressed, to your point.
Sure.
Now, I am not making up, I'm not making ends meet, and I am actually in debt. I owe more than I make. I'm living paycheck to paycheck. I'm not, now you're talking about misery, and people are really not healthy.
Right.
Now they compensate with maybe eating, or sometimes actually you'll start eating junk versus eating healthy, because now you can't afford potentially to buy the stuff, just because you want to meet the demand of the eyes of others. Just because people are judging now. If you're not dressed, if you wear a t-shirt that doesn't have a logo, that's a problem.
Yeah.
You want to have something just to show that you can afford it, right?
Right.
It's becoming a competitive society, to your point. Capitalism 101, spend. We want you to spend, we want you, but it's in your face everywhere. There's nowhere you go to. I mean, listen, I'm in sales and marketing, on my insurance world side, and it's all about promoting.
That's what it is. Yeah.
But we promote health. That's a little different, spin. But at the end of the day, every business out there is promoting. Yeah. And it's causing people to want to buy more, and causing more competitiveness, especially you go to a gym. I mean, you go to these gyms, some people walk in with Louis Vuitton bags and stuff. They dress up like they're going to a party. I mean, they're going to the gym, and I'm not criticizing. I'm just saying these are facts. Sure. So basically people are judging, and, based on what you do, they want you to be exactly like everybody else, otherwise you're not going to be conformed to the society requirements. That's a problem. And I think that's actually where we are today as a universe. And by the way, this is not just in the US. Europeans want to look like the Americans. The Americans want to, buy, European brands. Middle East, wants to just, mimic, the West. Everybody's like, we almost like like you buy. It's funny. You go to Europe, a pair of jeans that sells for $40 here sells for 300 euros, and vice versa. A product that is Europe made costs like thousands of dollars here.
Oh yeah.
And people are like, I need to have that. I must have that.
Yes.
And that's really mind blowing. I mean, when you think about it, it's like, whoa. But you're right. That is what's driving this hype. And unfortunately, it has a toll on our health individually, our families. Right. And ultimately, to your point, on the healthcare system.
Yes, absolutely. You talk about the tendency that we just want to kind of keep up with each other, right? Keeping up with the Joneses phenomenon. And it is such a temptation, right? But the other side of that is the opportunity cost, right? And so with every time that we're out there purchasing the next, I don't know, Gucci bag or whatever brand name thing that we don't need, we're actually losing out on a bit of opportunity. In other words, you're potentially missing out on the potential for financial independence. So, in other words, if you, yes, you know, it is enviable to see your neighbors or your friends who have all these fancy things, and you want to be able to do likewise, right? But actually, if you were to be able to live well within your means and you know, kind of forego a lot of these things that are not going to translate to increased happiness, even though it is pleasurable, but are not going to improve your happiness, then you'll actually get to the point of becoming financially independent. And then those folks that you were envying, they're going to be envying you, right? Because now here you are, independent of having to be obligated to be, you know, in a place you're working 9 to 5 in front of a computer, being sedentary. You actually have the freedom to be able to do the things that you want to do. So you'll find that you're actually the envy of your neighbors. So,
well, you know, it's amazing that you said it, because you're right. I mean, you gave the example of a Gucci bag, and it's a couple of $1,000s if you invest them into something. They can turn into multiple Gucci over
exactly.
a couple of months. And
Exactly.
You're right. I mean, I think the difference between being an entrepreneur and you know, a different financial savvy
Mm-hmm.
is the sacrifice. It's gonna be
Mm-hmm.
hard in the beginning, so you
Sure.
want to be like, you know, almost like tight with your finances and very
Mm-hmm.
picky with them, and you only spend them as needed. But
Mm-hmm.
then you invest your excess into what can bring you enough value, and then eventually you don't have to. You're independent completely, and that's
Yeah.
really what the millionaire concept
Yeah.
is. I mean, that's what, you know, what people refer to as the 1% and stuff. They invest
Yes.
their assets, and they make assets for themselves to
Mhm,
generate
mhm.
income, so they don't have to worry about, you know, I have to be physically there. The money is coming in whether I'm there or not.
Mhm, mhm,
But and you're right. I mean, people say money does not bring happiness
mhm,
or health. You know, while there's some truth to that,
mhm,
but you
mhm,
can actually buy, you know, peace of mind. You can.
mhm,
I mean,
mhm.
it's not going to buy you health. If you know, if you're sick,
Sure.
you're sick. It might
Right.
find you. It's like, but what it is that if you're stressed less, you
Yes.
eat healthy, you are rested well and stuff like that, you're not getting the stresses that can
Yeah.
affect your health, your ulcers, and everything else that can happen.
Yes.
Right?
Yes.
So there is that part. It's just, again, it's, you have to find the right balance. Now in your book, I love it
Yes.
because it's almost like creating that formula for us. I mean, it's not even creating,
Right.
it's really just highlighting it, because it's always
Yes.
been there.
Exactly.
People
It has.
need to see it, to hear it more, and be able to
Right.
kind of almost relate to it.
Yeah. You know, I mean, you know, there's nothing that's all that uh, revealing about some of the financial advice in the book, right? It's things that we have all heard of. Here's a little secret. It's very simple. One, live well within your means, and two, invest the good part of your the amount that you save. And what I bring to the discussion is that, you know, if you really buy into the science that shows that, in fact, the best things in life are free once you meet some of your basic needs, then you will do far more than the typical financial advisor would recommend. So in other words, most financial advisors might tell you to put away 10% or 20% at the most. But you know, if you can actually buy into this mindset, you can easily put away 30, 40, 50%. And for some folks, that could be 70, 75%. You know, it's a way of recognizing what the science of well-being is telling us, that in fact, beyond a certain level, once you've met your basic needs, the purchases that we make really don't translate to increased happiness. Even though it brings some temporary pleasure, it's not going to increase your happiness levels. And so if you take that and you take advantage of it by not overspending, and in fact, shifting that over to investing, then you'll get to the point of financial independence. Now, here's an important point. Just because you're financially independent doesn't mean you're going to be retiring. I hope a lot of folks don't retire. I mean, life becomes a lot more interesting all of a sudden when you become financially independent. and then maybe you want to work with your current employer. Absolutely nothing wrong with that. But I kind of present the story in the book of a character that I talk about, who gets to the point of becoming financially independent, and then actually goes back to work and actually enjoys the work that they are doing in a way that they wouldn't have before. In a way, and they're able to contribute a lot more. They're, first of all, more healthy, and as a result, they are also more engaged. They have the freedom to be able to choose what projects they want to work on versus not, because again, you're not obligated to that employer. If you wanted to, you could split with them, right? And so you have the leverage to be able to negotiate in a way that you couldn't before, right? And so the point of all this is not to say you should be financially independent and therefore retired. No, I'm not necessarily advocating that. I just think that there's a lot of things that you could do once you gain affluence of time in a way that you can't, because we are, unfortunately tied to our employers.
Doctor, it's amazing as you're breaking that story or that example. You're right. If you are, it's a sense of security.
Yes.
You're not afraid to lose your job.
Exactly.
You're not afraid that you're going to lose your home. Your basics are, you're never going to be starving. And so you can, talk the way you want, feel the way you want, and be as direct as you can. Because a lot of us, sometimes in the workplace are afraid to say things how they should be said, because we're afraid of retaliation or the outcome of your verbiage or your word, the words you use. And
let me just add in, sorry to interrupt, but
no, not at all.
When you are then working for that same employer, maybe you work differently, and you work because you're really passionate about the product or service that you're putting together, and as a result, your productivity actually increases.
That's right.
And so I think there's a lot that we're leaving on the table that we can really benefit from if we recognize that the pathology that really is driving our chronic diseases.
Wow. It is amazing. And it's a change in behavior primarily. And by the way, you're right. The fact that you are independent doesn't mean, and by the way, a good, person that achieves that will never retire.
Yeah.
Because they'll always be doing something and being creative and reinvesting in other things.
Absolutely.
And you're right. Even if they go to, like some people say, first question we ask, if you won the lottery, would you work?
Yeah.
Well, there are people that have won lottery and still went back to work. Historically, that has been actually documented. But the bottom line is, you're right. You come back to work with pleasure. And
maybe you might work in a different way, right? So maybe you don't go back to your employer. Maybe you have a passion that you're interested in pursuing that you never been able to before, because again, you were tied to your employer. And so now you have the time to be able to say, hey, I want to invest in this. I want to see what comes of this. A lot of folks, they look at a person like Elon Musk and they recognize, they basically, adulatingly say that he's a genius, and he is, and I don't want to take away from that, but there's a lot of genius in your listeners sitting here, in all of us, right? In terms of, if we're freed from that sort of level of obligation where we're tied to an employer, we actually start to see things in ways that we don't now. We start to recognize that we have sort of creative interests that we had kind of neglected up to this point because we never had time to look up and see. And so, kind of a world of opportunity opens up to you.
Well, you're right, Doctor. But I think that as I said earlier, and you confirmed it, the fact is we've been conditioned to some of these. And sometimes listening to something like this, a talk like this, can make a difference in somebody's mind. Oh, damn. I am genius. And by the way, everybody has genius in them. Absolutely. It's like almost like, a button that's dormant. Sometimes you just have to press it.
Right.
And it takes that little booster, somebody to tell you something, an event that can change your life. Most of the successful people, and I had a couple of shows back, we had a similar discussion. A lot of successful people, why they succeed is because they had some crazy event in their life. It turned their life upside down, and that was the turning point. And because of whatever it was, now they live the life that they always dreamt of, they wanted, as opposed to the life they were, given at the onset.
Sure.
It changes. And you're right. You can maybe not go back to that same employer. Now you can do your passion, go find something that you really enjoy. You can own the same company. You really like it so much. You can buy shares, and now you're the president or the chairperson. I mean, that also happened before in history. So,
sure.
I mean, there's so many things, but I think the concept is, what does that mean in terms of health? Not only mental health, but also physical health.
Absolutely.
And then, to your point, society-wise, because now the damage is less, overall cost is less. Everybody else can benefit from this.
Exactly.
So it's amazing how it all correlates, as long as we can see
it really is
the connection and connect those dots.
If you look at what's happening in our healthcare system right now, we're basically again, seeing the rise of diabetes and obesity and even colon cancer, and major depressive disorders, generalized anxiety disorders. And you think about, what are all these doctors like me? What are we exactly doing? Because again, we're not controlling this. We're not getting a hold of this. We're not reducing the chronic disease burden. It's actually just increasing over time. And what I'd like to suggest is that, we're really kind of treating this as if you have a patient who has a pneumonia. And as you know, and you don't need to be a healthcare professional to know this, but you can't treat a pneumonia by just treating the symptoms of the pneumonia. You can't treat them by just treating the cough or just treating the fever. You have to treat the underlying infection that's causing the symptoms. And I guess what I'm suggesting is that these chronic diseases, whether it's diabetes or Alzheimer's or major depressive disorder, all these various disorders are really just kind of symptoms of the underlying pathology that's causing the rise of these chronic diseases, which if we don't address, it's going to continue to wreak havoc on our system. And so unless we see that consumerism, that's mindless consumerism, it is the thing that's driving our healthcare, causing the rise of chronic disease, then we're just never going to be able to manage the chronic disease burden that our healthcare system is meant to be built to manage, right?
Well, listen, you have a tough life in terms of the mission that you've chosen in the healthcare. I mean, you're right. You want to help everyone. You want to save everybody. You want to have everybody live as long as they can and as healthy as they can. But you cannot make that change unless the people make the change themselves. And not only, and that starts with their behavior, that starts with how they operate in their daily lives, their family, their consumption, and understanding their limits. It's funny, I use this analogy in a particular show. We're talking about martial arts. So this was a whole different topic. And, I think I mentioned something about the ninja diet. And so the ninjas, there's something I read before that they only ate when they needed nutrition. So they every day they ate, a certain way because they needed a certain amount of nutrition. That's it. They didn't eat more just because they had it available. Now we're talking about, feudal time, back in the Shogun era in Japan. Right. But the bottom line is, the concept is you eat when you need, when your body is requesting it. Culturally, now we have become so almost like hypnotized about food. And so we have 4 meals a day that have to happen. I mean,
plus snacks.
Well, exactly. Well, so plus snacks, right? So you have your morning, your lunch, your dinner, and you have some sort of afternoon, snack. I mean, more like crunchy, munchy thingy. And then at night when you're on TV, you're like munching some popcorn, whatever. And then you get the munchies at night. You wake up 2:00 and you get I don't know. That's been almost culturally, important. And if you're not doing that, something's wrong. Like I see people at work. It doesn't fail. At 12:00, people are cooking. They're in the kitchen cooking. I mean, I'm not saying that, some of the people have a good routine and they eat healthy, but at the end of the day, it's like we are almost like in that mode that you have to have enough meals, you have to have certain things at a certain time, otherwise life ends.
Sure.
And I don't understand, personally, I don't see the value of it, right?
Yeah.
But that's my opinion. Someone can say, well, you guys talk all this talk on this show, have you done any of that? Someone can probably challenge us right now and say, Dr. Hurricane, you guys talk a lot of talk, but do you walk the walk? And I can say we probably do. And, I'm not going to share anything about my personal life, but, in general, but I can say I've used this, me as an example. I actually apply some of these concepts. I don't overeat and do stuff. I do things by due measure as they, everything else. I try to keep a healthy lifestyle. I try to keep a different portfolio. And I enjoy what I do because I know that I can work with it or without it. I'm still my bills are gonna be paid. So but you get to that point after making a lot of mistakes.
Yes.
And over the years, I learned that I used to give this analogy one time financially. I at a point in my life, I drove a cab. And at a point in my life, I was the chief marketing officer. And so, and one day I said, I was making the same money. People look at me funny. They're like, how is that possible? The difference is when I was driving a cab, I had a very limited house, a small house, and limited expenses. When I got to this level, I upgraded everything, and actually, the balance is the same.
Right, exactly.
Your saving amount is the same at this rate. That's a problem.
Exactly. That is a problem. If you look at, just to give a little more background to that, that's something that's very real, right? In our everyday world, we see it. And so if you look at just the size of houses in America, back in the early 1900s, sorry, it was almost just a third of the houses that we have today. And so housing, the size of houses have increased by a factor of almost 3 times. And yet our levels of happiness as a society has actually just declined a little bit in the last few decades. And so, it's just kind of pointing to the fact that, we're chasing after the next big thing, and yet it's not really fulfilling.
Well, I can say this, Doctor. I made a joke about this, even within the family, is that doesn't matter what house you live in, you only sleep in the bed, and it only takes about, a couple of feet of space in that bed, and that's it. When you sit, you don't sit around the whole house, you sit in a particular spot. We spend almost the same time in the same place. If you have a living room, that's where you spend most of your time, and your bedroom is the next one. Sometimes we have, a lot of space in our homes, and we don't even use some of those rooms. And that means we pay for real estate that we don't need. That's like if you have a business and just, take a whole suite and you only use one office in the suite.
Right.
It wouldn't be savvy business, right? But I think we apply that in our life because of what we said earlier. We tend to want to compete. And yes, I mean, listen, there's the ability to dream. If you can afford that, why not? I'm not against that. I mean, but to your point, you got to get to the point where you can do that and not worry about it. So now you're at a point, it's okay. I can have that extra space and enjoy my backyard and do whatever. But am I doing it where I can do it for half of the price? Or am I doing it like the other concept I use is do not downgrade your lifestyle, upgrade your finances. So if there's the other way, I can either cut my expenses or like multiply my income. I mean, resources, right? That's another way to look at it. And if you did that without the stress, you got to do it in a happy means, right? Happy way, right? So, I mean, it's a concept, and everybody has a different way of doing and approaching this. So,
absolutely,
So, in your book, you've highlighted a lot of these elements, but what is the bottom line core message that you really drive to everyone listening and watching that we all can take away? I already got the core message.
Sure.
If we want to just summarize it for them. Because we covered a lot of grounds here.
We did. Let me put it this way. Again, going back to the prescription that our politicians are giving us, right? There really is almost 2 different approaches to addressing our health crisis. And the traditional way, which is again leading to the rise of chronic disease and rise of healthcare expenses and now declining happiness levels because it's adversely affecting our health, is problematic. Now, if you listen to what the conventional thinking is, the solution is to continue to spend even more amount, because you know what? By spending more, guess what? You're going to innovate more. And when you innovate more, you're going to be able to cure a lot of the chronic diseases that you can't even manage today. You're going to be able to cure diabetes and Alzheimer's and cancer and things that we can't even barely contain in today's world. And you know what? So here's the problem with that thinking. They're right, actually, that we can get to the point of being able to cure a lot of the chronic diseases that we cannot even get control of today. That is very true. But we have to differentiate between managing chronic disease and improving health. Okay, so if our goal is to manage chronic disease, then yes, some of these things actually will result in finding cures, and we're going to be okay. But if by focusing on increasing productivity on a societal basis, that is increasing GDP, focusing on GDP growth as our end all and be all, that if that's what we're trying to pursue, and as a result, even though our chronic diseases are cured, we are increasingly sedentary so that we can be increasingly productive, then our health is not going to be any better. Okay, so our health, the way to improve health is through those things that are actually free to us already. It's just that we need to be able to be free to be able to move instead of just tied to our desks from 8 to 5. We need to be able to be free to make the food that we already have that's nourishing for us, instead of purchasing the convenience of the fast food industry that's there to sell to us, right? And we need to be able to sleep adequately, right? So healthy living translates to a healthy diet, exercise, and good sleep. Those are things that are free to us already. Now, diet, again, we have adequate food now. It's just a matter of preparing. It's just a matter of having the time to be able to prepare that. And so, really, if we're trying to improve health and thereby well-being and happiness, then I think this pursuit of endless overconsumption is a mistaken pursuit. And what we really need is to be able to recognize that the underlying issue that's driving a lot of the rise of chronic disease is our overconsumption. And then be able to recognize that the easy part is fixing the problem, because fixing the problem means you're going to actually be wealthy. You're going to gain affluence of time, and you're going to have a lot more income through your investment. And so I'd like to suggest that's just a much better way of living.
I would tend to agree. And as a matter of fact, while you're speaking, I'm thinking about, someone can say, well, we live in a society, that you're free, you want to buy whatever you want and stuff. But you're right. You can, if you're rich, you can. Nothing's going to stop you. But if you're barely making it and you do, you're just affecting yourself. It's like an adverse reaction.
Exactly.
So at the end of the day, you are not asking people to drop being capitalists. You just ask them to be smart.
No. Yeah, I mean, let me make that clear, because I'm actually a fan of capitalism. Okay, because there is no other economic system in the world that has lifted hundreds of millions of people out of extreme poverty in the way capitalism has. And yet, beyond a certain extent, though, if we don't recognize that overconsumption is what's driving our adverse health outcomes, and therefore adversely affecting well-being and ultimately happiness, then actually we're kind of shooting ourselves in the foot. And so, it's not that we need to change our system of capitalism. No, absolutely not. I think it's a system that that really works very well with regards to some things, but it does need us to be able to take advantage of the fact that if we invest enough, then we can actually become free of the obligations that are financial obligations that are tying us to our unhealthy lifestyles, and as a result live a much more fulfilling life.
And I agree. And by the way, I just wanted to clarify something, because some people could say, well, well, there's a 1% or a few people, the rich, that don't want everybody else to be rich. You know, I do believe that we do live in a country where right now, if you want to become a millionaire, there is a way. I mean,
Mhm,
you got to
mhm,
take chances. I mean, we have new millionaires every day.
mhm, mhm.
You know, people, younger people are getting into that bracket more often than people can imagine,
Mhm.
in using technology and stuff, investing in all that. Like we talked metaverse, NFTs, and there's new things out there that people don't may not even be aware
Sure.
of, that are the wave of the future.
Mhm,
And so let's not keep that mentality, pushing us down and keeping us locked on the ground.
mhm,
If you want it so bad, you can do it. And and
mhm,
and
mhm.
and there is, as people may say, the American dream still lives. It may be different. It may be, a different angle, but we have more people during the pandemic. A lot of people have found themselves in, people are making thousands of dollars a month right now on
Yeah.
TikTok. I mean, it's just by
Yeah,
putting content. So
you're right. I mean, really, the sort of principles that I talk about in the book, and again, it's nothing, extremely revealing there. That's really the very much a mainstream approach that financial advisors, for the most part, would agree with. Again, I just say that we should be investing a lot more. But if you look at who can benefit, really, it's the vast majority of people, right? I mean, certainly anybody who's middle income on up, but even a large part of the lower class, at least the upper half of that lower class, can get to the point of becoming financially independent by following some of those principles. Now, that doesn't mean that everybody can. There's certain folks that really have high expenses for whatever reason relative to their income. That is not necessarily of any fault of their own. And so there may be some folks who can't get to the point of becoming independent. That doesn't mean that they won't benefit still from applying some of these principles. So if they, even for folks who have a relatively lower income, applying some of these same principles, you can get to the point of maybe you don't have to work two jobs. Maybe you don't have to work, that second shift or whatever it is. I think that there's a lot of folks who can still benefit, whether you're ultimately going to get to a point of financially independent or not is still, it's a worthy goal, but that still doesn't necessarily mean that you don't have that same benefit that will then translates to some health benefits too. And I talk about that a little bit more in the book. So,
and doctor, thank you for that clarification. But I just wanted to add one thing. So
yeah,
you can be, a lot of people start poor, and
yeah,
again, a lot of people come here as immigrants with nothing, and it's how how you're kind of focused can make a difference. Yes,
yes,
you can start from the ground up. I mean, some people can be on top and they drop. When I mentioned earlier about the people
sure,
that have
yeah,
been super successful, they've dropped to the zero, to nothing,
yeah,
and had to
yeah.
start again from up. And this time they build a better foundation.
Mm-hmm,
So
mm-hmm.
so we can always blame everything, and and unfortunately, some of us might still stick to that because it's comfortable to always have that. Or we can say enough is enough. You know what? If
Mm-hmm,
they can,
mm-hmm.
one person is doing it, I want to try to do it at
Sure,
any level I am.
yeah,
So again, and when I'm saying this, I'm not saying it in a negative way. I'm saying in a
yeah,
positive, that anyone listening, watching, you can do it. You
yeah,
have the ability to do it.
mm-hmm.
There is no magical, stuff. It may be more
Yeah,
difficult, less
yes,
access to resources, but there are
definitely,
resources out there, if
yes,
you look deep enough. And like, I mean, again, we're talking about, I mentioned TikTok earlier. It's a wealth of knowledge. People are sharing
yeah,
information left and right to promote their own stuff, but it's good stuff. I
mm-hmm,
mean, you
mm-hmm.
have to vet it out for yourself. But a
Sure.
lot of it, I look at things. I see something, I check it out, and some of it is really good stuff.
Some of it is.
I mean,
So,
some of it. I mean, obviously, there's a
mhm.
lot of bullshit, but
That
again,
too.
it is a platform for for everybody, right?
Yeah.
But you have people that give real stuff that is valuable, and real content, and real data, and some people are given just to get viral, but that's okay. But again, we have to always do our due diligence. We don't take even this show. I mean, you don't have to listen to us and take it for granted.
Mhm.
Read the book, whatever, find out for yourself. If
Yes.
it's not for you, it's not for you. That's okay. But
Sure.
but at the end of the day, it is one step closer to something that you're probably looking for. And
Yeah.
that's really what you need to. It's that one degree, one element, one step, one little shift can make a difference in everybody's life. And that's really the bottom
Absolutely.
line. So, because people sometimes like, what do you know about being poor? What do you know about? Well, I can say I'm an
Sure.
immigrant.
Yeah.
I
Yeah.
started, with a little bag, in New York City. So I
Wow.
didn't know anyone. And
Mm.
we can talk about my story, and that's not a
Sure.
problem. It's not a secret.
Hmm.
But the bottom line is there's so many folks that do more, that've done more.
Yeah.
Okay. And I still want to do just more.
Hmm.
there's
Hmm.
there's no limit until I'm unable to do it. I'm going to continue doing something,
Hmm.
right?
Hmm.
And
Hmm.
I do what I love. I mean, everything I do, I enjoy. I wake up in the morning, I'm still happy to do my job. I'm happy to do
That's
my
awesome.
show. But I'm an example, but I like to use this as a motivation. I'm
Hmm.
nobody, and if I can do it, a lot of people can do it, and everybody can do it. So that's in my mind. At least that's what keeps me going every day.
Yeah.
This is a platform to share with people how they can be better. Bottom line, we would have not put one-on-one together, health,
Sure.
and this today.
Yeah.
We do that. We are putting it together in a way that is
Yeah.
like, we started with an MD, and now we're talking about finances. And how did
Exactly.
that even work? Well, it did. I
Yeah.
mean, if you listen to this whole show, it sounds a little
Yeah.
off, but at the end of the day, the message is very simple. You
Yeah.
know, we can change ourselves, we can change our society, we can change our
Yeah.
behavior, we can actually contribute to ourselves and families, as well as the health of the benefit of society,
Yeah.
by doing it differently. And sometimes, we need to be different,
Mhm.
innovative, out of the box, or maybe no box
Yeah.
in this case.
Yeah. Yeah.
So we've taken more time than we allocated, and it's just interesting. We can talk more. So just to close the show, first of all, where is the book available? Where can people actually get access to it?
Sure. Yeah, absolutely. It's available on any major retailer website, Amazon, Barnes and Nobles. You could go to my website, healthinflames.com, and you can find a list of retailers that you can purchase it through. So yeah, it should be widely available through most retailers.
All right. Well, we're gonna have that on the description of the show, so look forward to that. You want to listen to this, you want to take some of it, and listen, you just grab a couple of elements from this show and take it and apply them. Things will turn. I don't want to say I guarantee it, but you don't need my guarantee. You just have to test it out. That's all.
That's right. That's right.
But these are concepts. I mean, Dr. George has got a lot of experience and been out there and done a lot of stuff, and running a multi-family practice, and it's not a picnic, and I'm sure you do a lot more than just that. So
Thank you.
obviously the reason you wrote this book is you are actually in that world and you understand how it works and dynamics.
Yes.
So please, I mean, listen, you mentioned Elon Musk. He does
Mhm.
exactly that. He's all
Mhm.
over the place, and you know what?
Sure.
He's making it work.
Yeah. Yeah.
And he would say himself, we can do the same. The problem is
Yeah.
he's willing to take risks, and he's
Yeah.
willing to do multiple things. Sometimes we're just afraid. Don't be
Sure.
afraid.
Yeah.
So
Yeah.
so I want you to give us your last words of wisdom, at the end of the hour here. So what would you leave our audiences with?
Really kind of a call to action. So three different things that I think I hope you guys will take advantage of. One, please do read the book, Health in Flames, a doctor's prescription for living beyond diet and exercise. And two, I want you to share it with your family and friends and get the word out there. Even request it at the local library, because it's not really about profiting off the book. It really is about getting the message out. And then two, if you're really interested and want to help out at that next level, I'd like to suggest, we kind of talked about this in the context of how this benefits the individual, but there really is a way that it benefits society as a whole. So I'd like to encourage some of you guys to take that next step and join me in implementing some of the policies that I talk about in the book, that I think is going to be influential in a way that benefits not just a person who reads the book, which is great, but really we can implement benefits that can translate to a benefit for the society as a whole. So I hope to hear from you, some of y'all. So.
All right. Well, thank you, doctor. And again, you'll have the contact in the description of the show. So please feel free to reach out, get the book, learn, and, apply, whatever you can. You'll be very intrigued by, the content, and you will enjoy it. So that I can say. So that being said, first of all, doctor, thank you for spending, an ample time with us. We've exceeded our hour. We didn't expect to go, but, we usually limit it to the hour, but, it was intense and it was fun. And I think there was so much to cover. So we did it. And folks, thank you for listening, watching, and always look out for the next topic, guest, and show coming soon. Ciao, ciao for now. Bye-bye.
Thank you so much.